Okay, this is my audience for the explanation project. I'm just going to set them down there. So to get started, have your horses been vaccinated this year? You can show me by just a raise of hands. All of them have been vaccinated. And my second question is, do you know if your horse was vaccinated with the equine's herpes virus? And many do not know. There are no raise of hands. So it is very important for horse owners to become more educated on the equine herpesvirus, the proper treatment, and obtaining the vaccine. To start off, HIV is currently spreading rapidly worldwide, so it is important for horse owners to start taking action and learning these proper precautions for keeping their horses healthy. Montana is currently seeing the first outbreak in EHV this year, according to the Department of Livestock in Montana. There have been multiple cases around the entire state with high number of euthanized horses that are not being treated properly. They are stating that this high number is a lack of horse quarantined properly, not knowing the symptoms of the disease, and not being properly educated on the vaccines that are available. The first step for horse owners to keep their horses healthy is knowing the symptoms for this disease. EHV has many different symptoms. Symptoms are shown different through different incubation periods throughout this disease, and they either get a respiratory route of the disease or a neurological route of the disease. The respiratory of the disease starts with a fever. This first onset of the fever is 1 to 2 days in, and of a spike, and the next spike is about a week down. This would be your horse having a rectal temperature of around 100.5 degrees Fahrenheit. Another respiratory route of the disease is nasal and ocular discharge. This would be a runny nose, sneezing, coughing, more of those symptoms. The neurological part of this disease is much more rapid and more onset than the respiratory aspect. This would include horses having all different sorts of neurological signs: head tilt, not keeping up their balance, high-limbed weakness. Both authors, Kirkland and Simone, are both educators in equine education. Simone is also the current regent manager in veterinary medicine, and those are the authors that wrote this article about symptoms. As it is very important to know the symptoms of EHV, it is also important to know how it is transmitted to our equine animals. EHV is very contagious, and it is spread directly from horse-to-horse contact. It is airborne, so it is spread through the air. When a horse sneezes and another horse breathes it in, that would be the airborne content of that. Why this disease is so contagious, it is also indirectly spread to horses through physical objects such as clothing, horse buckets, hay, anything in a horse's stall. So that's what makes this disease so contagious. So I want to look at this graph really quick. This is an AC environment. This is inside a barn, so a stable environment, and this is outside. This is looking at how long will EHV stay affected and can be contagious. This dark blue is showing plastic, and the light blue is showing straw. Some of the two major things your horse drink out of a plastic bucket, and your horses live inside a stall with straw or shavings, and those are the number one things that EHV is living on and can live on. So I wanted to share that. It is a little bit unknown, but the maximum is 1 month for this virus to live is 1 month under perfect conditions, and 7 days to really transmit from two different conditions. The maximum or the most important measures are to clean equipment around your horse, around you. Before cleaning one stall and going to the next stall, it's very important to be cleaning properly. And this information I shared on how HIV is transmitted is revised by Dr. Nicole Prestella, and she wrote this with the American Association of Equine Practitioners, which was started in 1954. Now knowing how each EHV is transmitted to equine, we need to know how to prevent and protect our horses. Vaccines are recommended in foals, 4 to 6 months, and then their second dose in another 4 to 6 weeks, and another dose in another 4 to 6 weeks, and their third dose being at 10 to 12 months old. If we have adult non-breeding horses who have also not been vaccinated, it is important that they are also on that 3-dose schedule once it is their time to be vaccinated. So treating already infected horses, this is definitely going to be more directed on what symptoms your horse is having. If it's having a more respiratory direction of the disease, we focus on breathing treatments, giving albuterol treatments, taking care of that cough. Whereas if they are on the neurological side, we're looking at more muscle relaxers, anti-inflammatory. There are definitely different meds that your vet will recommend depending on the route that your horse's disease is leading. EHV is taking over Montana, and we need to take action because our numbers are continuing to increase. A great way for locals to stay up to date on where this virus is taking on Montana is by getting on the Department of Livestock. They have recently put cancellations on certain counties. They also are allowing you to see what day the horses in that county are being quarantined. So if you're traveling through Helena, it'll tell you that in that county, horses are on their 7th day of quarantine. So it is not safe to be going to the fairgrounds, to be in any sort of equine facilities there. We have covered every major point of EHV and the seriousness of the disease. And in conclusion, it is important to take action and provide protection to our horses. After travel, keep an eye out for symptoms pertaining to EHV. Make sure you are quarantining after exposure and reach out to your veterinarians for proper vaccinations or for vaccination records. Let's keep our horses healthy in Montana. Are there any questions?
Yeah, how do you test your horse for this equine herpes virus?
That is a great question. So you can, there's a nasal swab that is less accurate, but it'll definitely pick up on those beginning symptoms of respiratory infection. So there is a nasal swab that is usually an in-house treatment at vet offices. And there is also a blood draw that will be sent off that'll take 3 to 6 weeks that will have a for sure positive on whether your horse has EHV or not.
Thank you.
Thank you. I'm going to show them one more time. And that is the end of my explanation project. Thank you.